Bempedoic acid is a new drug in treatment of dyslipidemia. The major effect of bempedoic acid is decrease in blood cholesterol level. Bempedoic acid has a unique mechanism of action. This drug inhibits cholesterol synthesis by inhibition of ATP-citrate lyase. Intake of bempedoic acid alone can reduce low-density lipoprotein cholesterol by 30%, which is quite significant. So, bempedoic acid belongs to a new generation of cholesterol-lowering drugs. The major lipid-lowering mechanism is based on inhibition of ATP-citrate lyase. But in addition to this, bempedoic acid can stimulate the function of AMP-activated protein kinase, which provides glucose-lowering effect and anti-inflammatory effect. These two additional effects allows bempedoic acid to decrease blood triglycerides level, improve insulin sensitivity, and improve glucose metabolism, which is very helpful in treatment of metabolic syndrome. So let's explain the mechanism of bempedoic acid in details. The major effect of bempedoic acid is based on inhibition of ATP-citrate lyase, which is one of the enzymes in the lipid synthesis. Recall that the other class of drugs that inhibit one of the enzymes in the lipid synthesis is statins. But as we'll see further, bempedoic acid acts on a higher level. In addition to this, with inhibition of ATP-citrate lyase, bempedoic acid provokes compensatory increase in production of membrane receptors for low-density lipoproteins, which in turn leads to a more rapid clearance of LDL particles from the blood. So let's explain how inhibition of ATP-citrate lyase leads to a decrease in blood cholesterol level. Recall that when glucose enters into the cell, glucose undergoes glycolysis to pyruvate. Then in the mitochondria, pyruvate undergoes degradation in the Krebs cycle to acetyl-CoA. After this, we convert acetyl-CoA to citrate, and citrate undergo transportation through the mitochondrial membrane into the cytosol. In the cytosol, citrate by ATP-citrate lyase undergo conversion to acetyl-CoA, and acetyl-CoA has two pathways. First of all, we can convert acetyl-CoA to HMJ-CoA, and HMJ-CoA by HMJ-CoA reductase is converted to mevalonic acid, and from mevalonic acid we make cholesterol. The other option is to convert acetyl-CoA to malonyl-CoA. This conversion is provided by acetyl-CoA carboxylase. From malonyl-CoA we make fatty acids, and from fatty acids and glycerol we make triacylglycerols. Also recall that gluconeogenesis and fatty acid synthesis are tightly connected. In gluconeogenesis, we use oxaloacetate, from which we make phosphoenol pyruvate. This reaction is catalyzed by a specific enzyme called phosphoenol pyruvate carboxykinase. Then from phosphoenol pyruvate we make glucose 6-phosphate. And to convert glucose 6-phosphate to glucose, we have to cleave the phosphate group. And this cleavage is provided by a specific enzyme called glucose 6-phosphatase. All these reactions occur in the hepatocytes, so it's a liver tissue. And liver can take some amount of cholesterol and triacylglycerols, add to them a little bit of proteins, and altogether cholesterol, triacylglycerols, and proteins will form a very low density lipoprotein particles. After the LDL particles are formed, liver secretes them into the blood. In the blood, the LDL particles deliver fats to peripheral tissues. Mostly, the LDL particles deliver fatty acids. What is left after the delivery, and as we can see, mostly it's cholesterol, we call low-density lipoprotein particles. LDLs have two pathways. First of all, if LDL particles encounter the LDL receptor on liver tissue, they do not sync twice. LDL particles bind to this receptor, and LDL receptor uptakes these particles into the liver tissue. This pathway is the best possible scenario. The second pathway is the bad scenario. Some amount of LDL particles in the blood undergo oxidation, and such oxidized LDL particles will be uptaken by the macrophages that are located in the blood vessel wall. And when macrophages uptake LDL particles, the content of LDL particles begin to deposit within the blood vessel wall, and with time, progressive accumulation of cholesterol leads to atherosclerosis. The major effect of bempedoic acid is the inhibition of ATP-citrate lyase. If bempedoic acid will bind to ATP-citrate lyase, this enzyme stops working. As a result, the formation of substrates from which we make cholesterol will decrease, so cholesterol production will decrease. And also, the formation of substrates from which we make fatty acids will decrease, and as a result, triacylglycerol's production will decrease. So, as we see, by inhibition of ATP-citrate lyase, bempedoic acid reduces the production of cholesterol and triacylglycerols. And exactly inhibition of ATP-citrate lyase we consider as the major lipid-lowering mechanism of this drug. But as we know, bempedoic acid has the second mechanism of action. This drug also stimulates the function of AMP-activated protein kinase. By direct activation of AMP-activated protein kinase, bempedoic acid provides inhibition of the key enzymes involved in the gluconeogenesis. But in addition to this, stimulation of AMP-activated protein kinase provides inhibition of the crucial rate-limiting enzymes in cholesterol and fatty acid synthesis. So let's explain this second mechanism of action. Bempedoic acid stimulates AMP-activated protein kinase. First of all, with activation, AMPK inhibits the function of acetyl-K carboxylase. With inhibition of acetyl-K carboxylase, the formation of substrates from which we make fatty acids decrease, so triacylglycerol's production will decrease. In addition to this, AMP-activated protein kinase inhibits the function of HMJ-CoA reductase, which is a crucial enzyme in cholesterol synthesis. So now, with inhibition of HMJ-CoA reductase, the formation of substrates from which we make cholesterol will decrease, so cholesterol production will decrease. But also, AMPK-activated protein kinase inhibits the function of enzymes involved in gluconeogenesis. First of all, AMPK inhibits phosphoenol pyruvate carboxykinase. With inhibition of phosphoenol pyruvate carboxykinase, the formation of substrates from which we make glucose decrease, so glucose production will decrease. In addition to this, AMPK inhibits the function of glucose 6-phosphatase. And because it's a crucial enzyme in the gluconeogenesis, now with inhibition of glucose 6-phosphatase, glucose production will decrease, simply because without this enzyme we cannot form a free glucose molecules. With decrease in glucose production, glycolysis decrease. This will cause decrease in formation of pyruvate, acetyl-K, and citrate. And because from citrate we make acetyl-K, inhibition of gluconeogenesis causes decrease in production of acetyl-K, which is the major substrate for synthesis of lipids. With decrease in acetyl-K, the formation of substrates from which we make cholesterol will decrease, so cholesterol production will decrease. And also, without acetyl-K, the production of fatty acids will decrease, and thereby it will cause decrease in production of triacylglycerols. As we see, all these effects lead to a reduction in cholesterol and triacylglycerols production. Without cholesterol and triacylglycerols, the production of VLDL particles decrease. First of all, with decrease in VLDL production, the formation of LDL particles decrease, simply because LDL particles are formed from VLDL particles. But in addition to this, decrease in VLDL production by compensatory mechanism stimulates the production of LDL receptors on liver tissue, and with increase in the quantity of LDL receptors on liver tissue, the uptake of LDL particles from the blood will increase, and as a result, the concentration of LDL particles in the blood decrease. And the lower the amount of LDL particles in the blood, the lower is the chance that some of them will be uptaken by the macrophages to the blood vessel wall, and thereby the lower is the risk of atherosclerosis. So, as we see, bempedoic acid causes decrease in concentration of very low density lipoproteins. But mostly, bempedoic acid affects the concentration of low density lipoproteins in the blood. First of all, decrease in LDL concentration will cause decrease in blood cholesterol level. But also, with decrease in the LDL concentration, the level of triglycerols in the blood will decrease. And because bempedoic acid inhibits gluconeogenesis, with decrease in glucose production, blood glucose level will decrease. So by prescription of bempedoic acid, we can decrease the concentration of LDL and VLDL lipoproteins, we can decrease blood cholesterol and triglycerols level, and all this combined will significantly decrease the risk of atherosclerosis. In addition to this, bempedoic acid can decrease blood glucose level, which is perfect for people with metabolic syndrome and diabetes type 2. On top of that, bempedoic acid, by stimulation of AMP-activated protein kinase, provides anti-inflammatory effect. As we see from this picture, the major effect of bempedoic acid is inhibition of ATP-citrate lyase. But also, by stimulation of AMP-activated protein kinase, bempedoic acid provides anti-inflammatory effect, which can decrease the progression of atherosclerosis. The standard dose of bempedoic acid is 180 mg per day, which results in reduction of LDL cholesterol by 30%. This drug is the most effective in patients with diabetes due to the additional glucose-lowering effect. Very important that we can use bempedoic acid in combination with other lipid-lowering agents. For example, in combination with ezetimibe, that can provide 40% reduction in LDL cholesterol. Ezetimibe is one of the novel drugs in treatment of dyslipidemia. Ezetimibe blocks cholesterol absorption in the intestine, and the lower will be the absorption of cholesterol, the lower will be the income of cholesterol to the liver tissue. So ezetimibe basically potentiates cholesterol-lowering effect due to the completely different mechanism of action. Also, we can use bempedoic acid in combination with statins. This can provide additional 15% reduction in LDL cholesterol. The reason why combination with statins is not as effective as combination with ezetimibe is due to the very similar mechanism of action. Statins block HMG-CoA reductase, and because bempedoic acid already, to some extent, inhibits the activity of HMG-CoA reductase, statins just potentiate this inhibition. Decrease in activity of HMG-CoA reductase cause decrease in formation of mevalonic acid, and thereby it will cause decrease in production of cholesterol. So, to some extent, statins can potentiate the cholesterol-lowering effect, but not as effective as ezetimibe. Another option is to prescribe a triple therapy, which is combination of bempedoic acid, ezetimibe, and statins. This can provide decrease in LDL cholesterol by 60%. The next drugs that we can use in combination with bempedoic acid is PCSK9 inhibitors, which can provide decrease in LDL cholesterol by 30%. PCSK9 inhibitors stimulate the production of LDL receptors, and the higher will be the amount of LDL receptors on liver tissue, the higher will be the uptake of LDL particles from the blood, which eventually will cause decrease in LDL concentration in the blood. Here we can see the effectiveness of cholesterol-lowering treatment. As we see, the highest efficiency has a triple therapy, but as you may guess, this option has also the highest amount of side effects. In addition to decreasing cholesterol, bempedoic acid provides decreasing fatty acid synthesis, which results in decreasing triacylglycerols production. And nowadays, we know that bempedoic acid provides 15% reduction of plasma triglycerides level. Because bempedoic acid inhibits fatty acid synthesis, potentially we can use this drug for treatment of hepatic steatosis. But the problem is that in humans, only 10% of intrahepatic triglycerides are produced by fatty acid synthesis. So bempedoic acid won't dramatically change the situation. One of the major side effects of statins is increase in risk of new-onset diabetes. In contrast to them, bempedoic acid provides substantial benefits in case of diabetes by improving glucose metabolism and insulin sensitivity, which is possible due to the activation of AMP-activated protein kinase. The major reason why bempedoic acid is so effective in diabetes is due to the inhibition of the crucial enzymes involved in glucose production. Interesting that metformin, which is still the first-line drug for treatment of diabetes type 2, has very similar mechanism of action, simply because metformin also stimulates AMP-activated protein kinase. So, because metformin activates AMP-activated protein kinase, it also inhibits the function of glucose 6-phosphatase and phosphoenol pyruvate carboxykinase, which results in decrease in glucose production and thereby in decrease in blood glucose level. And nowadays we know that bempedoic acid alone can provide decrease in glycated hemoglobin by 0.12%, which is a very good result for lipid-lowering medication. But the major beneficial effect of bempedoic acid is inhibition of atherosclerosis, which is possible due to the anti-inflammatory and cholesterol-lowering effects. So to summarize, bempedoic acid is used in treatment of atherosclerotic cardiovascular disease and in treatment of heterozygous familial hypercholesterolemia. Also, we can use it for additional lowering of LDL cholesterol. The standard dose is 180 mg per day, but we have to know that this drug also has side effects, and the most significant side effect is increase in uric acid level, which can be a significant problem in patients with gout.